The next question I'd like to address is, can PBC cause diseases outside the liver? And it depends on how we want to describe a disease. So the answer to that is yes, there are multiple extrahepatic manifestations of PBC. What does that mean? It means that there are multiple manifestations or multiple other conditions that we see linked to PBC that occur in a person that don't reflect a liver injury. One of the two most common autoimmune-esque complications that we'll screen for are thyroid disease. So thyroid disease is much more common in people with PBC, so much so that our guidelines recommend annual thyroid testing to make sure that we don't miss early thyroid disruption. The second thing that's autoimmune associated is a condition called Zika syndrome. This is dry eyes, dry mouth, and we know that this is so common that we recommend that our patients with PBC see their dentist as well as an eye doctor on a regular basis, because the PBC can increase the chance of getting cavities or gum disease or even corneal abrasions if your eyes get really dry. The other extrahepatic manifestation of PBC we'll often talk about is osteopenia or osteoporosis. PBC is strongly linked with an increased chance of having weak bones. It's really important to do weight-bearing exercise to help battle that, but we'll also make sure that we're very careful with vitamin D levels and recommend DEXA studies or bone density studies on a regular basis to be able to identify early and then use agents that can help stabilize or even build that bone density.